Hello. All right. This is going to be the feeding resident lab. So we always hand sanitize. Gotta hand sanitize. It's most important. So we sanitize our hands, rub it all around until it's dry to make sure that it is truly in there. And we're gonna wake up a resident and explain to him. Explain to him what is going on. Hello, Jenkins. How are you doing today? We're gonna eat. Okay, is that okay with you?
Yes.
Perfect. So what we're actually gonna do is we're gonna go. What we would do is we'd go grab a washcloth or a towel or whatever, and we'd get it wet, and we'd also get a dry one, and we'd come back and we would wash his hands because you always gotta wash their hands. So we're gonna wash his hands, probably up to an inch or so, or 2 inches up the wrist, both hands. Normally you go to the other side of the bed for this, but so once you're done with that, you dry it off with another towel, making sure to get all the crevices and stuff to make sure nothing bad happens to Jenkins. And then you dispose of this in the hamper if you had one. And then you bring your table over. We don't have a table, so I'm just gonna pull uh, this way. And today we've got well, for us it's an empty pudding cup and a Dr Pepper can, but it is pudding and some water in our imaginary world. So what we're gonna do is we're actually gonna feed. Well, we raised Mr. Jenkins' bed, which I can't do, so I'm actually just gonna put a pillow back here for you, so you can sit up a little bit. And we're gonna feed Mr. Jenkins, making sure to alternate between um, pudding cup and water. You'd have gloves on before you do any of this because you don't want to touch the resin. So you put the gloves on, making sure to hold it from the bottoms, and then we're gonna start having some dinner. And this entire time you're talking to Jenkins, making sure he's okay. Making sure he's not choking as well. That would be terrible, but So you know, making sure they chew. Where at the residence I work at, a lot of them pocket in their cheeks, so you gotta make sure they don't do that. Water would help with that, of getting it down, and you know, and again, you're making sure to alternate, um, between them. Yeah, and you know, probably not going as quick as I am, but taking your time, especially most of them are slower. And you would repeat this process until their food is gone or they are sufficiently full. Uh, and then once you're done with that, you're probably gonna re-lower them to a comfortable position. Give them their call light to so that if they have anything they need, they can call you. And then you're going to dispose of your rubber gloves, taking them off from the bottom. I don't have rubber gloves, but you get the point. And you would sanitize your hands because always. So we're rubbing it on all surfaces, and then once it's all dry, we stop.